Welcome back to the channel. My name is Dr. Nate. I'm a physical therapist and the founder of Back Unbroken, where we help people get out of long-term chronic back pain for good. In today's video, we're going to take a look at another YouTube video from the Mayo Clinic titled The Do's and Don'ts of Exercise with Low Back Pain. This is a really common issue and question for most people that we work with, is how do you exercise safely and comfortably when you're going through back pain? And are there things that you should be doing and other things that you should be avoiding? So let's dive into this video and see what the Mayo Clinic says about do's and don'ts of exercising with back pain, and I'll add my own thoughts along the way. All right, number one piece of advice from the Mayo Clinic is do start slow. It says if your pain is acute and you've been resting, start with low impact. Think walking or gentle yoga. So off the bat, this is a great place to start. You definitely want to start slow if you're in a more acute or flared up phase. Really, the only thing you want to think about during these times where the pain is really high and you're not able to do much is what is the smallest amount of exercise or movement that I can get in without making things worse. I don't necessarily love the term low impact because I think sometimes that implies that things that are quote unquote higher impact are going to be worse for your back, and things that are low impact are inherently safer or healthier. That's definitely not the case, and there absolutely is a time and a place for more high impact activities, but I think most people have that perception that low impact is safe and high impact is dangerous or not good for pain. But in the context that they're saying here with more acute pain, or if you've been resting for a while, absolutely it's great advice to start slow and build up. All right, next piece of advice is don't rely on bed rest. Your body needs to move to recover. Focus on any activity that doesn't cause more pain. Again, pretty good advice here. If this video was 15 or 20 years old, it might look a little bit different. It used to be much more common advice to tell people with back pain that they just need to rest it off, or things like bed rest and staying inactive is the best way for things to heal. We now know that that's absolutely not the case, and movement is going to be your best friend when it comes to pain. Obviously, that's tricky because if you have low back pain, a lot of movements and activities and positions can trigger your symptoms. So the advice that they're saying here, and what I would echo, is to focus on any activities that you enjoy that don't acutely increase your symptoms. So if that's something like walking, like this guy is doing with his dog, if it's yoga, if it's stretching, but the big piece of advice here is to focus on movement rather than rest. The one thing I would push back on here is the idea that you need to only focus on activities that don't cause any discomfort. Again, this is a really fine line because if you have back pain, you know that it's really easy to set off your symptoms or make things worse going forward. So we want to stay out of that zone where the pain is clearly worse afterwards, or you have an increase in symptoms that night or the day after. But I would push back on the idea that it's not okay to feel a little bit of discomfort or pain when exercising. The vast majority of cases of low back pain, especially chronic or long-term pain, are considered medically and structurally safe, and the increase in pain that you get is more likely an increase in sensitivity than an increase in injury or damage in your body. I obviously can't say anything specific for you, but that is going to be the vast majority of these cases of back pain, like 90+%. So if you get some low-level discomfort or pain when exercising, it's not necessarily an indication that that's a dangerous or a bad thing. It's usually more of a sensitivity of something that your back is not used to doing or is not prepared for. So in those cases, it's totally fine to, again, feel some low-level discomfort or some stiffness or a little bit of pain that you have to work through, and it's not usually an indication that you're making things worse. All right, next piece of advice, do warm up. Start with slow stretching before active movement to prevent strains. Yeah, this one's kind of take it or leave it. The whole stretching thing is very overrated when it comes to back pain. If it feels good, or it warms you up, or it helps you feel more confident or move a little bit better during your actual exercise, then go for it. But it's absolutely not going to be a prerequisite to preventing injury or getting out of pain. A much better approach to warm-ups is to look at the exercise or the activity that you're just about to do, and to do some smaller scaled version of that to start with that you can slowly scale up until you hit the actual full activity or exercise. So for example, if you're going to be squatting, instead of doing a bunch of random mobility drills or stretches before you squat, the best warm-up to squatting is some version of squatting. So maybe you start with a quick 5 or 10 minute walk to get some blood flowing, and then you do a couple body weight or air squats. And then if you're using a barbell, maybe you warm up with an empty bar, and then slowly you start start adding weight onto the end of the bar until you hit your working weight. Or as another example, if you're gonna go play tennis or some specific sport, your warm-up should very closely mimic the stuff that you're actually gonna be doing on the court. You should be warming up with some skipping or hopping or lateral jumps, maybe some swinging or rotational movements. But that general approach of mimicking the activity or exercise that you're about to do is gonna do way more from you from a warm-up and injury and pain prevention standpoint than some random static stretching that you do lying on the floor. So I like the general advice of warming up, that's very important, but the idea that the best warm-up is gonna be some kind of stretching, I would definitely question that piece of advice. All right, next up, don't be a weekend warrior. Not moving during the week, then pushing it on weekends sets the stage for back pain. Move daily. This one is awesome. This is one of the most common triggers I see for most people with back pain, whether or not it's actually related to some kind of athletic event. It's really easy to see how this could be an issue when it comes to sports or athletics, like you see this example of the guy playing basketball. Because if you go for a long period of time without playing a sport or doing some activity and then all of a sudden you jump into it, I think most people have the understanding that you're probably not going to be super prepared for that and your body might feel a little bit stiff or uncomfortable afterward. But this doesn't just apply to sports. This applies to any increase in movement or activity that your body doesn't have on a regular basis. If you consistently average 3,000 steps a day and then you go away on a, let's say, a trip to Disney and all of a sudden you're averaging 15,000 steps a day, your body and your back are probably not going to feel great from that, even though we know that an increase in steps is helpful for things like pain. And this is because you're breaking the rule of twos. You did too much too soon after too little for too long. Our bodies love consistency and they stay pretty well adapted to our current levels of fitness. So if you all of a sudden do way too much too soon after not doing that thing for too long, it's a really easy way to trigger pain or set off symptoms. So this is a great piece of advice. Don't be a weekend warrior and just think about how this applies to things outside of sports as well. All right, next tip, do get advice from a pro. Ready for strength training? Learn good form to avoid jerking and twisting that can lead to further injury. All right, kind of some mixed thoughts on this one. I do like the idea of getting advice from a pro. I think that's very important. If you're really struggling with back pain or exercise goals, or definitely the combination of those things, I think it's invaluable to work with someone or get some structured help with those things. Which, by the way, if you are struggling with back pain and you can't seem to break out of it and you really want to get back into a consistent and comfortable exercise routine, consider joining me in Back Unbroken. I'll leave a link down below if you want to check it out and learn more. It starts with a 5-day free trial. It's helped hundreds of people get out of back pain and back into a consistent exercise routine, and it could do the same for you. So I'll leave that link down below if you want to check it out. The next thing I do like here is the idea of strength training. Strength training, in my opinion, should be an absolutely mandatory form of exercise for everyone. You don't have to be some crazy lifter or bodybuilder in order to get the benefits of a good strength training routine. It's one of the safest and healthiest things you can do, and it has a ton of benefits when it comes to back pain. So I love the idea of strength training. The idea of learning good form to avoid jerking and twisting that can lead to further injury, I'm kind of mixed on that one. I think form is important in certain situations, but I think a lot of people have the perception that perfect form is one of the most important things when it comes to preventing pain or injuries. And this just really is not the case. You can absolutely get injured or experience pain with quote unquote perfect form. Again, a lot of this has more to do with your body's preparedness for an activity or a lift or how much weight you're using, rather than what someone arbitrarily deems as perfect form. If your body's prepared for it and you build it up in a slow progressive way, lifting with ugly form or form that some people would see and deem as unsafe can actually be a way safer and more comfortable way to train than someone who has perfect form but is very random with their programming and how often they do the lifts and how much load they use. So work on your form, try to lift with good technique, but it's definitely not the most important thing when it comes to pain or injuries. All right, next piece of advice, do listen to your body. If your pain flares up while exercising, switch to something gentler. Moving should feel good. All right, in general, I think that's good advice. You should absolutely listen to your body. If something is not comfortable, or again, it's clearly gonna make things worse later today or into tomorrow, pull back and do something easier, but continue continue to move if you can. And again, movement should feel good. You should listen to your body. You should upregulate or downregulate what you're doing based on what your body is telling you. But again, the one small caveat here is that it's okay to feel a little bit of stiffness or discomfort or low levels of pain when exercising. Movement should feel good and you should feel confident in what you're doing. But we also shouldn't be so reactive to symptoms that the moment we feel some kind of stiffness or discomfort developing, that we immediately leave the gym or stop the activity that we're doing. Listen to your body and respect your pain, but try not to be super reactive every time you feel a symptom. So overall, honestly, pretty good advice from the Mayo Clinic and pretty up to date with what we currently recommend for back pain. Exercise can be one of the best or one of the worst things for back pain depending on how you navigate it. If it's really random and infrequent and constantly pushing you past what your body is capable of, then it's probably always going to be uncomfortable and hard to get back into. But if it's slow and consistent and builds up progressively over time depending on how you're feeling, it can be one of the most important components for getting out of back pain. Again, if you need help doing this or getting back into an exercise or a strength training routine, or you're just ready to finally get out of long-term back pain and get back to living your life, I encourage you to learn more about what we do at Back Unbroken, watch our free masterclass, and consider giving us a 5-day free trial. It may just change your life. So I'll leave a link down below. Make sure to like and subscribe if you want to see more content like this, and I'll see you in the next video.